What are the fertility challenges with non-seminoma testicular cancer? Imagine facing a diagnosis of non-seminoma testicular cancer and wondering how it might affect your future family plans. The truth is, treatments for this type of cancer can influence fertility in several ways, but outcomes vary from person to person. Let's explore what you need to know. When doctors treat non-seminoma testicular cancer, they often remove the affected testicle through a procedure called orchidectomy. Usually, losing one testicle doesn't cause infertility because the remaining testicle can produce enough sperm and testosterone. However, if the other testicle is small or not functioning well, fertility might be reduced. Sometimes, additional surgery to remove lymph nodes in the abdomen, known as retroperitoneal lymph node dissection, is necessary. This surgery can damage nerves that control ejaculation, leading to a condition called retrograde ejaculation, where semen enters the bladder instead of exiting through the penis. This can make conception more difficult even if sperm production remains normal. Chemotherapy is a common treatment for non-seminoma cancers, and while it is effective at destroying cancer cells, it can also impact fertility. Chemotherapy often causes a temporary or sometimes long-term reduction in sperm production, leading to azoospermia, which means no sperm is present in the semen. For at least 2 to 3 years after treatment, many men experience low or no sperm count, and the chances of fertility returning depend on the chemotherapy regimen and individual factors. Despite this, many men do recover their fertility over time, but some may experience lasting effects. Research shows that survivors of non-seminoma testicular cancer often report concerns about their ability to father children. About 20% of survivors face long-term fertility or sexual difficulties, especially those who had both surgery and chemotherapy. However, there is no evidence that children conceived after treatment have higher risks of birth defects or health issues. To help preserve fertility, doctors usually recommend sperm banking before starting treatment. This involves collecting and freezing sperm for future use. If a man develops retrograde ejaculation, sperm can sometimes be retrieved from urine for assisted reproductive techniques. Regular follow-up tests to assess sperm production can help guide family planning decisions and provide reassurance. In summary, treatments for non-seminoma testicular cancer can pose fertility challenges mainly through potential damage to sperm production from chemotherapy and disruption of ejaculation from lymph node surgery. However, many men retain or recover their fertility, especially with proactive measures like sperm banking. Every individual's experience is different, so consulting with healthcare providers specializing in cancer and reproductive health is essential for personalized advice and planning.